Thank you, Dr. Voon. So the floor is open for questions and comments.
Thank you, Dr. Voon. It's very interesting. Early on, you said that methadone was implicated in 25% of the overdose deaths. Are you distinguishing there the methadone prescribed for pain from the methadone in the methadone treatment programs? Is that the total, or is one or the other? Question make sense?
I don't believe that it distinguished between, I think the majority was for methadone maintenance treatment. There might have been also methadone for cases such as cancer pain. I'd have to go back and check. But I do believe the majority of those were for methadone maintenance treatment.
Hi. I had a question around education and some of the focus with medical professionals. It appeared to me that there was a strong focus on addiction medicine and the fellowship training programs and otherwise in addiction. I didn't hear as much on pain management and a real focus on better pain treatment within a clinical setting. I'm curious if you could talk to us a little bit about that and if there was a reason for that focus.
Yeah, definitely. That's something that we want to work towards. Unfortunately, at the moment, there's not a lot of good evidence out there on really how to treat pain in individuals with a history of substance use. So I think that's part of the problem. But as we build that evidence base, certainly we want to start more fellowship training programs that can better combine both the addiction treatment competencies as well as the pain management competencies for this particular population. And I think it's a problem that's common in many settings where there seems to be a divide between the pain and addiction world, where more and more, I think, they're being very much coming from the same population. So, yeah, I think that's something that a lot of us can work towards better integrating.
Thank you, Dr. Voon. Could you speak a little bit more about the fellowship training program and a little bit more about the content of that program, as well as the individuals who are entering and how is it supported?
So this fellowship program, it is supported in part by a donation. Goldcorp is a mining company that has donated funds to help support the education for addiction practitioners. It's unrestricted funding, so they don't have a say in any of the actual courses that go on, but that's part of the funding. And then also for the research side, that is supported by a NIDA R25 grant to help develop clinician scientists able to contribute to addiction research. And basically, it's just an application process every year where anyone who's interested can apply, and there's a selection committee. And each year, well, the numbers seem to be growing, but this year we have taken in 8 addiction physicians. There are 4 nurses who are undergoing the fellowship and 1 or 2 social workers. So definitely there's the demand, and funding is definitely something that we are looking to expand as the demand continues to grow.
And if I remember correctly, you yourself held that fellowship. Is that right?
Yeah, so I did the fellowship last year, and it's really, I haven't seen many other opportunities for nurses to take on formal addiction training programs, so I thought that was very helpful to be able to go around and see the range of different addiction treatment services in our setting, as well as to get some formal training in research related to addiction. It's not something that's common for nurses, and also the interdisciplinary setting was really something that I haven't found to be available as often. So we really got to do didactic learning with physicians and social workers and discuss, there's journal clubs and site visits in collaboration with the physicians. So it's a great model, I think, for other people that are interested in doing something similar.
Any other questions?
Just curious about how you're handling your rural and frontier areas and whether you're seeing as much growth in those rural areas as in the urban areas.
Sorry, growth in terms of addiction?
Addiction,
or?
yeah.
Yeah, it's definitely a problem for us. One of the things that we've implemented is telehealth medicine. So we're trying to expand the role of our addiction medicine consult team here. So we're based at a hospital in downtown Vancouver, but recognizing that often clinicians in rural and remote areas don't often have access to specialized addiction services, we are implementing a telehealth line where practitioners can phone in and speak with the attending addiction physician on call to consult them on any difficult cases. And as well, we are opening up a rapid access clinic where individuals can be seen as outpatients here in the hospital rather than having to find treatment in a long-term community setting. They can come in here and get a consult right away.
All right. Well, thank you very much for joining us for this workshop. I don't know whether you'd been attending for the time that before you began, but you're welcome to remain on the line, so to speak.